And in the 6 months since the pandemic broke out in the United States, just a little more than 500,000 children have been diagnosed with COVID-19. That's less than 10% of total cases. And that's according to a new report from the American Academy of Pediatrics and the Children's Hospital Association. But how do the statistics we're seeing translate to what children in our country are actually experiencing? LEX 18's Sophia Millar reports.
The number of children diagnosed with COVID-19 continues to rise, both in Kentucky and in the United States, according to a report from the American Academy of Pediatrics. The same report shows in the matter of 2 weeks, the total number of children testing positive for the virus in Kentucky shot up by about 1,800 cases. But although children are testing positive for COVID-19 more often, Dr. Carol Steltenkamp explains the number of kids getting seriously sick remains low. She says if we want to know the impact of COVID-19 on our kids' health, we need to look at different data.
So we also could consider looking at how many of these children actually required hospitalization. Did they require ongoing care?
The data released by the American Academy of Pediatrics tells us the total count of cases. Dr. Steltenkamp says those numbers are going up because as we start doing more routine things, we're asking more and more people to get tested. She says, for example, nowadays you get tested for the virus if you're going in for something like a routine tonsillectomy.
Now, they may have been totally asymptomatic, but that test then comes back positive. That sort of example is reflective of much of what we're seeing when you're looking at the increased number of cases.
But just because the rate of kids hospitalized due to COVID-19 remains low, it doesn't mean the consequences of the virus disappear.
Children have the potential to be vectors. They can carry the disease, and they can then in turn have the potential to infect those around them.
Dr. Steltenkamp says it's important to continue following CDC guidelines. Wear a mask, keep your distance, and wash your hands. Sophia Millar, LEX 18 News.